This video demonstrates a midline interhemispheric approach for a tumour with an exophytic component in the third ventricle. This is a 9-year-old girl presenting with visual deterioration. Having performed a craniotomy, 2/3, 1/3 bridging the coronal suture, the brain is exposed, and gradual dissection, freeing up the arachnoid adhesions, is then performed. Care is taken around the cingulate gyrus. The adhesions are gradually released with a microdissector. And then we start to see the corpus callosum, the bright white structure at the base of the view now. The dissection continues to expose a wider portion of corpus callosum, and the two pericallosal arteries must clearly be visualized to ensure that they can be preserved and protected. A rolled up patty is then placed both posteriorly and anteriorly within the dissection field. These gently hold open the exposure and mean that less retraction is needed. The trajectory is then confirmed using the navigation, and then gradually the corpus callosotomy is commenced using a combination of bipolar and suction. Usually a 15mm length of callosotomy is sufficient for this approach. As the callosotomy continues, you can now see CSF appearing, and this is actually from the space between the two leaves of the septum for this child. So you can see the bifid septum visualized there. I now dissect through the right leaf of the septum pellucidum into the right lateral ventricle, and you can start to see now the choroplexus coming into view and the tumour just in front of it. So now you can see the tumour bulging through the right foramen of Monroe with the choroplexus behind it, and now you can also see the thalamostriate vein posteriorly laterally as well, and that completes the exposure.